Good afternoon, everyone. My name is James Testaverde, and I am the Senior Director of Patient Services at the Crohn's and Colitis Foundation of America. On behalf of the Foundation, welcome and thank you all for attending today's program entitled Health Insurance Marketplace 101. This program is developed and presented in partnership with the Centers for Medicare and Medicaid Services, and the presentation will provide the most up-to-date information regarding the Affordable Care Act as well as the health insurance marketplace. CCFA would like to take this opportunity to thank CMS for presenting this valuable information today. Within the week, you will be able to access the audio recording of this webcast on our website. For this and our other webcasts, please visit the following website, www.ccfa.org/resources/webcasts. I hope that all of our webcast participants can see the title slide and hear me. If you're having difficulty hearing through your computer speakers or headset, please dial 1-866-952-8437 and use access code 440-390-483. After the presentation, we will answer some questions from our webcast audience. Please keep in mind that today's speakers are not medical experts, but can address your general questions on the information presented. Webcast participants can ask questions at any time during the presentation by entering the question in your control panel, which should appear on the top right of your screen. If we are not able to answer your question, CCFA's IBD Help Center can be reached Monday through Friday, 9 a.m. to 5 p.m. Eastern Standard Time by calling 888-694-8872 or by emailing info@ccfa.org. We also encourage people using social media to continue the conversation by using hashtag IBDHealthcare. I now have the pleasure of introducing our speaker for today's program. Tarnisha Brown is a health insurance specialist in the Office of Communications at CMS. In this role, her focus is training related to the programs that the Centers for Medicare and Medicaid Services administers to help people make informed healthcare decisions. She has a broad and diverse training background that includes instructional design. Ms. Brown received her bachelor's degree from the University of Maryland and earned her master's of science degree in health services administration from Central Michigan University. We are very excited to have Tarnisha with us today, so without further ado, I will now turn the program over to Tarnisha.
Thank you so much, James. I'm excited to join you today for the review of Health Insurance Marketplace, which we call Health Insurance 101. So let's begin with what exactly is the healthcare law. It's a law that was signed in March of 2010 by President Obama, and it is called the Affordable Care Act, and some of the features is that it allows young adults up to the age of 26 to stay on their parents' health plans. It provides additional drug coverage for people with Medicare. It also includes more free preventive services. It eliminates lifetime limits from health insurance, and beginning this month in January 2014, we have been able to add even more features as a result of the Affordable Care Act. Moving on to the next slide, I would like to highlight what is new beginning January 1st of 2014. Discrimination due to an individual having a pre-existing condition or based on someone's gender is now prohibited. The annual limit on insurance coverage has been eliminated. Advanced premium tax credits for people who get their health insurance through the health insurance marketplace is available. The small business tax credit will increase, and more people are going to be eligible for Medicaid depending on whether or not that particular state has decided to expand its Medicaid eligibility. And consumers who started to select their qualified health plans beginning in October, if they signed up in time, their coverage could have begun as early as January 1st, 2014. Moving on to the next slide. I wanted to give you a little bit more information about the health insurance marketplace. It is a part of the Affordable Care Act of 2010, and the health insurance marketplace is designed to help individuals find health insurance that fits their budget. So every health insurance plan in the marketplace offers comprehensive coverage, and that includes doctors, medications, and hospital visits. What's wonderful about the health insurance marketplace is that you can compare all of your health insurance options in one place, and that's going to be based on price, benefits, quality, as well as other features that are important to you when you are selecting health insurance. And all of this is in plain language that makes sense to people. Inside of the marketplace, the plans are known as qualified health plans, or QHPs. So whenever you see that, you'll know that they are referring to the plan. And some people refer to the health insurance marketplace as an exchange or as Obamacare. So if you hear those terms, they are referring to the health insurance marketplace. There's also a marketplace for small businesses, and that is referred to as the Small Business Health Options Program, or SHOP. And so this marketplace is for small businesses so that they are able to offer health insurance to their employees. But for the next few slides and for this session that we are discussing here today, we're going to focus on the individual marketplace, not necessarily the shop marketplace. Okay, so the marketplace is a way to shop for health coverage. And about 90% of the people who currently don't have health insurance will qualify to get a break on their costs. This includes coverage by Medicaid, the Children's Health Insurance Program, as well as getting reduced cost or cost savings in the marketplace. Now, thanks to new rules and expanded programs, even working families are able to get help through the health insurance marketplace. There are new expanded programs available, and more people are qualifying for free or low-cost health insurance programs through the marketplace. Again, because the options are all in one place, individuals and families are going to have the opportunity to make an apples-to-apples comparisons with the plans, take a look at them, understand the cost of the plans, the benefits of the plans, the features of the plans before making a decision on which plans best fit their needs. Now, there are three ways that a marketplace can be established, but every state, no matter where someone resides, will have and has a marketplace. So the state could choose to create and run its own marketplace, and in that case, it's referred to as a state-based marketplace. The state also had the option to partner with the federal government so that the federal government runs some of the functions while the state runs others, and that is a partnership marketplace. And then the other option is to have the marketplace established and operated by the federal government, and that is the federal marketplace. Now, each plan in the marketplace is a qualified health plan, and all qualified health plans are required by the health care law to cover 10 essential health benefits. And these benefits are before you, and you'll see that they include ambulatory patient services, which is the outpatient care you get without being admitted to a hospital, emergency services, hospitalization, such as if you need to go into the hospital to have surgery, maternity and newborn care, which is care before and after a person's baby is born, mental health and substance use disorder services, including behavioral health treatment, and this includes counseling as well as psychotherapy, prescription drugs, rehabilitative and habilitative services and devices, such as devices to help people with injuries, disabilities, or chronic conditions gain or recover their mental and physical skills, laboratory services, preventive and wellness services, and chronic disease management. And finally, pediatric services are also an essential health benefit, and that includes oral and vision care for the pediatric age group. Now that we know exactly what a qualified health plan must cover, I do want to share with you that all qualified health plans are not going to be the same. They can vary, and that includes that some plans may cover additional benefits. So in addition to the 10 essential health benefits that I just shared with you, they may offer and cover additional benefits. Some qualified health plans may require you to see certain providers or use certain hospitals that are within their network. The premiums, co-pays, and co-insurance are going to be different in different plans. But again, when someone is using the Marketplace, all that information will be made available so they can compare the plans that they are interested in. And the quality of care can vary by plan, but all the quality data is available so that individuals and families can review that data before making a selection. The coverage level can vary with each plan, and some plans are structured differently. For example, there are some high deductible plans in the Marketplace. So all plans must cover the essential health benefits. However, the plans can vary. Now we're going to talk a little bit about the plan levels of coverage within the Marketplace. And you'll see here on this graphic that it ranges from the lowest premium and the highest out-of-pocket cost to the highest premiums and the lowest out-of-pocket costs. There are plans inside of the Marketplace, and we refer to them as the metal tiers, and they include bronze, silver, gold, and platinum. Now generally with the bronze plan, 60% of the total cost of care is going to be covered. With the silver plan, it's generally 70%, gold 80%, and platinum 90%. What's important for each individual and family who is getting health insurance through the Marketplace to remember is they need to make a decision based on their individual needs and how they use their health insurance. So for example, if in the past you have been healthy and traditionally only go to see a medical professional for your preventive service and wellness, then you may want to consider the plans that have a lower premium and the higher out-of-pocket cost because you're not going to utilize your health insurance benefits that often. Now, if you're on the other side and you know that you have a medical condition that you must frequently see a health care provider or frequently have some type of testing done, you may want to consider paying a highly monthly premium, but it would lower your out-of-pocket costs when you go to see those providers. So again, lots of flexibility, lots of choices, and each individual or family needs to find the fit that works best for their current health care needs. I did mention to you that there are different types of plans within the Marketplace, and now we're going to focus on catastrophic plans. And a catastrophic plan generally requires that you pay all of your medical costs up to a certain amount. And so these are, this is a high deductible plan. So generally you're going to pay several $1,000s up front before you start, the plan starts to have cost sharing with you. Costs for essential health benefits over that amount are generally paid by the insurance company. So once you've met that high deductible, your essential benefits costs are generally going to be paid by the insurance company. Now, catastrophic plans are generally going to have lower premium to protect against high out-of-pocket costs, and they cover 3 annual primary visits and preventive services at no cost. These plans are available only to people who are under 30 and people who have received certain hardship exemptions. Each member of the family must meet eligibility requirements in order to purchase this type of plan. I do want to point out that people who do enroll in this plan who have catastrophic plans, they are not going to be eligible for the premium tax credits that lower their monthly premiums. And that's one of the cost sharing, the reduction in cost that I said approximately 90% of people would be able to get. Anybody in a catastrophic plan is not eligible for the premium tax credit. Okay, so we have focused on the marketplace for individuals. Now let's take a look at how the marketplace for small businesses works. And this is, again, referred to as the Small Business Health Options Program, or SHOP Marketplace. And with SHOP, small businesses have access to a streamlined way to offer health insurance to their employees for 2014 and for future years. It's open to employers with 50 or fewer employees in 2014. And in 2016, the program will be open to businesses with 100 or fewer employees in all states. And a few states could choose to expand the eligibility to businesses before 2016 with 100 or fewer if they choose to. So small businesses, including nonprofit and religious organizations, can participate in the SHOP Marketplace. For those who complete the enrollment process by the deadline, the coverage will take effect as early as January 1st. So there are some people who are businesses who have already signed up, and they are able to offer health insurance to their employees through the SHOP. And SHOP also works with the new insurance reforms and tax credits. So that helps these small businesses to afford to offer their employees health insurance coverage. And you will see here if you are a small employer or if you had questions about how the SHOP Marketplace works, there is a dedicated help desk for employers, and that number is 1-800-706-7893. Now, switching back to the individual marketplace, let's talk about exactly who is eligible to participate. There are several eligibility requirements, and that includes that you have to live in the marketplace service area. So when the states and the federal government, when we were working with the plans to establish the marketplace, those plans set up what areas they were going to serve, and that's called their service area. So an individual or family has to reside in the service area of that particular marketplace. In addition, you have to be a citizen of the United States or a national, or you can be a non-citizen who's lawfully present in the United States for the entire period for which enrollment is sought. You must not be incarcerated. However, if you are incarcerated, you can apply for coverage from the marketplace if you are pending disposition of charges, and you can also apply for Medicaid or the Children's Health Insurance Program at any time. Now, when you use the marketplace, you may be able to get lower costs on your monthly premium as well as out-of-pocket costs. Out-of-pocket cost is the money that you spend in addition to your monthly premium. So when you pay the health insurance company every month, that's your monthly premium. But when you go to see a healthcare provider, that's your out-of-pocket expense. So if you go to the doctor and you often have to pay a copay, or you see the doctor and then they send you a bill and say your insurance company paid this portion and now the remainder is your responsibility, those are your out-of-pocket costs. So the premium tax credit is generally available to individuals and families with incomes between 100% and 400% of the federal poverty level. And that amount changes annually. So if you don't have access to certain types of minimum essential coverage, this is going to be able to help those, and it will be more affordable. Now, the minimum essential coverage includes government-sponsored coverage. So if someone has Medicare, Medicaid, CHIP, coverage through VA or TRICARE, or if they are employed and their employer offers affordable employer-sponsored insurance, then they have what they need, and they are considered to have minimum essential coverage. The advanced premium tax credit available through the Marketplace lets you reduce your premiums right away, or you can wait to receive the premium tax credit when you file your taxes. So again, you have choices. Some people want to save immediately. So if you decide that you want to save each month on your premium, you can, if you qualify for it, select the advanced premium tax credit, or if you want to wait until you file your taxes and then get that money with your tax refund, then you have that option of doing it that way as well. So this chart illustrates the 3 ways you can choose to take your premium tax credit. If you use it all, you lower your premium the most. You would most likely not get money back as a credit on your federal tax return if you decide to use it all. So if your circumstances, like your income or your family size, change and you don't notify the Marketplace, you may have to file taxes. So if you know that you're getting a raise on your job, or if your family size has changed, you want to let the Marketplace know, and then they can adjust your credit accordingly so that when you do file your taxes, you will not owe. And then you can also see information if you wanted to wait until you filed your taxes. So this is a chart that illustrates the 3 ways that you have to use that premium tax credit. Now, cost-sharing reductions are also available in the Marketplace in addition to the premium tax credit as a way to reduce your out-of-pocket expenses. To be eligible for the cost-sharing reductions, you must have a household income that is less than or equal to 250% of the federal poverty level, and you have to meet the requirements to enroll in a health plan through the Marketplace and receive the new tax credit and enroll in a silver level plan. So I shared with you those metal tiers. If you are someone who's interested in the cost sharing reduction, you must enroll in a silver level plan. That's part of the eligibility requirements. Now, members of a federally recognized Indian tribe may also be eligible for special cost sharing reductions. So certain American Indians and Alaska Natives who purchase health insurance through the Marketplace do not have to pay copays or other cost sharing if their income is under 300% of the federal poverty level. Now, the healthcare law also, in addition to creating the health insurance Marketplace, it expanded Medicaid eligibility in the states who chose to expand their Medicaid eligibility. And what it does is it fills certain gaps in coverage for the poorest Americans by creating new opportunities for those states to have minimum Medicaid income eligibilities across the country. So beginning this month, in January 2014, individuals under 65 with incomes up to 133% of the federal poverty level are eligible for Medicaid in those states that have implemented the Medicaid expansion. In addition, the healthcare law ensures Medicaid coverage for all children who are part of families with incomes up to 133% of the federal poverty level. Now, for those states that previously covered children who fall in this category through their CHIP program, they will continue to receive the enhanced CHIP matching rate so that they can continue to provide this coverage. And in addition, the rules for counting income for purposes of determining Medicaid and CHIP eligibility has been changed. So it's much simpler and easier for families to understand. So now the way that that is calculated is known as the modified adjusted gross income. And that allows individuals and families to understand how they qualify for Medicaid or the Children's Health Insurance Program. Okay, beginning this year, everyone must either have minimum essential coverage, have a coverage exemption, or they will be required to pay a fee, which is known as the shared responsibility payment. So you'll see here these are the three options. If you have minimum essential coverage, you don't have to do anything. You're already covered. If you qualify for an exemption, you won't have to pay the fee, even if you don't have coverage. But you have to remember that if you don't have coverage, that means that you won't have health insurance. And the third option is that if you don't have coverage and you don't qualify for an exemption, then you have to pay a fee. So let's take a look at what that means. Minimum essential coverage. This is coverage that meets a standard that provides the essential health benefits. If you have any of those types of coverage that you see on your screen, you have minimum essential coverage and you don't have to do anything. About 85% of Americans have minimum essential coverage. So you see here employer coverage, Medicare, Medicaid, the Children's Health Insurance Program, Marketplace coverage, individual coverage that's purchased outside of the Marketplace, as well as TRICARE or certain types of coverage through the VA are all considered minimum essential coverage. Now, if someone has a health plan that only covers vision or dental, that would not be considered a minimum essential coverage. So you need to make sure that it's not a plan that has limited benefits. Now we're going to move on. Now we went to details of what the minimum essential coverage is. Now we're going to talk about the exemption, which was the second part of that. If you don't have minimum essential coverage, you might have to pay a fee. But you may also be able to get an exemption from the fee for one of the following reasons. If you have a religious conscience, if you have membership in a recognized health care sharing ministry, membership in a federally recognized Indian tribe, you have no tax filing requirements because your household income was below the minimum threshold. If you have a short coverage gap, so if you had health insurance but you lost it for less than 3 months and then you picked it up again, you would not be required to pay the fee. If you suffered a hardship, for example, a circumstance that affects your ability to purchase health insurance, like being homeless or recently experiencing domestic violence, then you would be able to get an exemption. If you have unaffordable coverage options, if you are incarcerated, or if you are not lawfully present, these are those individuals who are exempt and would not have to have, if they don't have coverage, they would not have to pay the fee. So let's move on and talk a little bit about the fee. So when an uninsured person requires urgent care and they don't pay the bill, everyone else ends up paying the price. And that could be your premium costs go up. And so that's why the health care law requires all people who can afford health insurance to take responsibility by getting coverage or by paying a fee. So people who choose not to obtain health and coverage will also have to pay their entire cost of their medical care. They won't be protected from the kind of very high medical bills that people often get, and sometimes those bills can lead to bankruptcy. So the way that the fee works this year in 2014, if someone does not have health coverage, they are going to be required to pay $95 per adult and $47.50 per child. Now, if you have a large family, when it comes to the per child price, you will not pay above $285 for the children. So it's either going to be that set dollar amount, or it will be 1% of your yearly income, whichever is greater. Now, these are the amounts for 2014, and they will go up after that. You need to remember that the deadline for the open enrollment for the health insurance marketplace ends on March 31st. But you don't want to wait until the last minute. So if you're an individual who needs health insurance, the open enrollment period is open, and you can enroll in a plan. And you'll see in front of you how the dollar amount changes as we move into 2015 as well as 2016 and beyond. Okay, I shared with you that the initial open enrollment period for the marketplace ends on March 31st. It began October 1st, 2013. Once the initial open enrollment period ends on March 31st, the next opportunity that someone would have to join the health insurance marketplace or get health insurance through the marketplace would be during the annual open enrollment period, and that would be October 15th through December 7th of every year. If you sign up for coverage between October 15th and December 7th, your coverage is effective the following January. If you are signing up during the initial open enrollment period, your coverage is effective the month after you have signed up. Now, there are always special situations and circumstances because life happens, and if that does happen, there are, in addition to these enrollment periods, special enrollment periods, and that's going to be dependent on the individual and their family and their particular situation. An example would be, I stated that in order to be eligible for the marketplace, you have to reside in the service area. So if you or your family moves from one state to another and you are now outside of that service area, you would have a special enrollment period so that you could select coverage in your new state and continue to have health insurance at your new location. So there are 4 steps to using the marketplace. The first thing you want to do is you're going to log on and create an account. Next, you're going to apply. You're going to enter information about you and your family. That includes your income, the size of your household, any other coverage that you're eligible for. All this information you will provide. The next step after you've applied, you're going to pick a plan. So you'll be able to see all the plans and programs that you're eligible for based on the information that you provided in step 2. And you'll be able to compare them side by side. You'll also find out if you can get lower costs on your monthly premiums and your out-of-pocket costs. So if you're eligible for that premium tax credit, you're going to find that out here, as well as if you're eligible for the cost-sharing reduction. And then the final step is for you to enroll. And the marketplace, all these 4 steps, you want to log on to healthcare.gov and follow these 4 steps. Now, there are 4 ways for you to get marketplace coverage. We have a telephone line that's available, and you can call that line at 1-800-318-2596, and a customer service representative can help you apply and enroll over the telephone. The call center provides information in English and in Spanish. However, there is a language line available that offers 150 additional languages. So if you or someone you know has a preference for a language other than English or Spanish, you just need to speak that language, and then the call center representative will be able to work with a language line to assist you. There is also online, I mentioned to you, healthcare.gov, where you can apply and enroll. We have in-person help available to get help from people in your community. They have been trained and they're certified to help you apply and enroll in the Marketplace. If you want to find out what's available in your area as far as in-person help, you can log on to localhelp.healthcare.gov, or you can call the call center and they'll be able to direct you to in-person help. We refer to in-person help as navigators, so if you hear that term navigator, then you'll know that that's in-person help. We also have certified application counselors who can provide in-person help. And the fourth way to get Marketplace coverage is by completing a paper application. So if you don't have a computer, or if you prefer not to call in, you can fill out a paper application. Just call the call center and they can either mail you an application, or you can go, if you don't have a computer, you can use one at the library or one at a friend's home, and you can download the application, fill it out, and send it in. Now, of course, the application online is going to be processed faster because you don't have the wait time of mailing in the paper application and getting it processed to get information about whether you are qualify for the premium tax credit or the cost sharing. A little bit more information about the in-person assistance. The certified assisters include navigators, non-navigator assistance personnel, and the certified application counselors. And they help you through the process of enrolling. Navigators can also help you understand how to use health insurance if there's someone who needs that help. And the certified application counselor they're there to help people actually apply and get through the application process. Now, in addition, there are other types of in-person assistance that includes agents and brokers. And what we want to note is that some of the assistance resources that include the Marketplace call center, the websites, and navigators, they are required to provide unbiased and impartial advice, while some, such as agents and brokers and issuer websites and their call centers, are not. Just wanted to share that bit of information for you. So again, you can log on to localhelp.healthcare.gov and you can find your local in-person assisters. I just want to highlight how Marketplace works with different groups of people. So if someone has Medicare, I want to make sure that you're aware that Medicare is not part of the Marketplace. So there's nothing somebody with Medicare needs to do. The Marketplace doesn't change Medicare. You don't need to log on to pick a plan. You just continue to work with the Medicare hotline, which is 1-800-MEDICARE, or Medicare.gov, to get your information and resources. As it relates to somebody with COBRA, COBRA happens if you have employer coverage and you leave that job, you may be able to keep your job-based coverage for a period of time. It's usually about 18 months of time. So if you have COBRA coverage during the initial Marketplace open enrollment, you can drop COBRA and pick up a Marketplace plan. The reason why this is important is because oftentimes COBRA is very expensive, and that's because generally when you're working, your employer pays a portion of your health insurance coverage and you pay a portion. But when you stop working and you get coverage, it's generally the situation is that you are now going to be responsible for 100% of that coverage. So the cost is high. So it's likely that you would be able to get a lower price plan within the marketplace. But it's important not to let your COBRA coverage end before your marketplace coverage starts so that you don't have a gap. If your COBRA coverage expires and you have not selected a plan in the marketplace, this would generate a special enrollment period, and then you would have 60 days to enroll into a marketplace plan. Now, the healthcare law established the pre-existing condition plan program, and that was because often people who had pre-existing conditions were not able to get health insurance, or they were charged a higher amount for their health insurance. That plan was always built as a bridge program until the healthcare law and the marketplace came into effect. So there are about 110,000 people currently in the PSIP plans, and if you are enrolled in a PSIP, you want to ensure no break in coverage by enrolling in the marketplace, and the PSIPs will send notices to their enrollees to make them aware and encourage them to take action so that they can make sure that they have made the switch before the deadline. So in summary, I just wanted to go over some key points for you to keep in mind when you're thinking about the health insurance marketplace. One is that it's a new way to find and buy health insurance. It's not replacing anything that's out there. So if you already have employer coverage either through you or your spouse, and your employer continues to offer that, you can stay there. There's nothing for you to do. This is a new and an additional option to get your health insurance. Individuals and small businesses can shop for their health insurance that fits their budgets and their health care needs through the marketplace. States have the flexibility to establish their own marketplace, to partner with the federal government, or they can ask that the residents of that state get their insurance through the federal marketplace. Individuals and families may be eligible for lower costs on both their monthly premiums as well as their out-of-pocket costs, and there is assistance available to help people. So we want to make sure that people are getting the best coverage for their needs, so take advantage of either calling the call center, going to healthcare.gov and reading more information, or finding an in-person assister to help you. Now, if you want to get up-to-date information, if you are looking to help other people learn more about the marketplace, or if you just want more detailed information, you can log on to Marketplace.cms.gov, and here we have consumer materials, training materials, research, and a lot more information. And you can sign up for updates there as well if you want to get an email or a text when anything significant happens or changes. You can do that. And we encourage everyone to stay connected. Sign up to get email and text alerts at healthcare.gov. The website is available in Spanish as well. There are updates and resources at Marketplace.cms.gov. We are on Twitter, so if you are using that form of social media, you can see what we are thinking and saying at Twitter, as well as we have Facebook, facebook.com/healthcare.gov, and you can like us. So that concludes a presentation or overview of Health Insurance Marketplace. And at this time, I am going to turn the phone lines over so that we can address any questions.
Great. Thank you, Tarnisha, for your informative presentation. But now, before we get to the question and answer session or part of the program, I wanted to discuss some of the CCFA resources that are available to you. CCFA currently provides a comprehensive series of education programs, resources, and support services to members of the IBD community, including patients and caregivers. The Irwin M. and Suzanne R. Rosenthal IBD Resource Center, also known as the IBD Help Center, is a free service designed to provide members of the IBD community with disease-specific information, guidance, and support. The IBD Help Center is staffed by caring master's degree level specialists who provide education on IBD management, available treatment options, and coping strategies, as well as referrals to helpful resources and programs. The IBD Help Center can be reached toll-free by phone at 888-MY-GUT-PAIN or through email at info@ccfa.org or via online live chat, social media, postal mail, or fax. And of course, the IBD Help Center is available Monday through Friday, 9 a.m. to 5 p.m. Eastern Standard Time. And as you already know, a webcast is a topic-specific online program designed to educate viewers on various aspects of IBD. And all of our live webcasts are actually recorded and placed on CCFA's website for individuals to download at their convenience. And our webcasts cover various topics ranging from disease management to diet. So if you're interested in learning about upcoming teleconferences or viewing any previously recorded webcasts, please visit www.ccfa.org/resources/webcasts. And if you're looking to connect with other patients, CCFA support services provide an empowering environment where IBD patients, as well as their caregivers, can find guidance, a sense of community, and some valuable resources. So our community website is a space where patients and caregivers can connect with one another through an online support group. And on the website, visitors can also enter into topic-specific discussion groups, viewer share personal stories, and get their questions answered by IBD experts. And to visit that website, you can go to www.ccfacommunity.org. And CCFA currently hosts in-person support groups at the chapter level, as well as a mentorship program, which we call Power of Two. And the Power of Two program allows patients who are seeking guidance on a specific issue or want to speak with a peer from within the IBD community who has traveled a similar path or has had a similar experience. We can connect those people through email, phone, or Skype. And to learn more about these support programs, you can visit your local chapter's webpage by visiting www.ccfa.org/chapters. Next slide. So Take Steps for Crohn's and Colitis is CCFA's family-friendly walk program that's dedicated to raising mission-critical funds for awareness for IBD. And within the last 6 years, the program has actually raised almost $40 million in support of our mission. And the Take Steps program is held in all 50 states and in more than 170 different communities across the country. And if you're looking to get involved with CCFA or simply want to find a walk in your area, you can visit us at www.cctakesteps.org. And for those who are a little more ambitious, CCFA also has its Team Challenge program. And Team Challenge is actually an endurance training and fundraising program. Through Team Challenge, you can participate in a half marathon or experience a triathlon while simultaneously helping to find a cure for Crohn's disease and ulcerative colitis. And to find out where and when the next Team Challenge event will happen, you can visit the website listed on the slide, www.ccteamchallenge.org. And I would also like to encourage all of you that are participating in the webcast to complete the post-program evaluation by following the link that's listed on the screen. Your feedback really helps us ensure that our programs are both meeting your expectations and they also help to shape our future programs. So now it's time for the question-answer part of the program. For everyone's benefit, if everyone could please keep the questions general and related to the health insurance marketplace, that would be appreciated. And again, webcast participants can ask questions by entering the question into the control panel, which should appear on the top right of your screen. Okay. So I'm scrolling through the questions, and many folks have questions about specific IBD medications that are being covered by the various insurance plans. So what advice can you offer patients who have a chronic disease such as IBD to find out what medications and treatments might be covered by these insurance plans?
What someone needs to remember is that health insurance plans in the marketplace are very similar to health insurance plans available before the marketplace was made into law. And as a result, the plans can vary, as I mentioned. So you have to, before you are selecting a plan, make sure that you are familiar with what that plan covers and what the benefits are. So to find out what prescriptions are covered through the plan, you can visit their website, and generally they're going to have their formulary listed. You can also, if you've already enrolled in the plan, you can review your summary of benefits and coverage, and that information will be there. You can call them directly if you want to find out if your particular drug is going to be covered. You can call them if you're already in the plan. There's going to be a telephone number for you to call somewhere on your ID card. It's usually on the back of the ID card, or if you are thinking about joining the plan, you can call the number available on their website to get information from them. And you want to make sure you review any of the coverage materials that before you sign up for the plan, to make sure that the drugs that you plan on using or the drugs that you are already using are going to be covered.
Great, thanks. Could you also clarify the role of the navigator and how they can help when looking for more information on health insurance plans offered through the marketplace, and what the navigator can help you with and what they might not be able to help you with?
Okay, now the navigator is there, just as the name implies, to navigate through the process. They will be able to show you the plans that are available in your area and work with you to make a decision. However, ultimately the decision is going to be up to the individual who is enrolling in the marketplace. So they're not going to actually enroll a person, but they will share with them all the information that they need to make the best healthcare decision for them. But they can sit with you, help you understand the marketplace in your area, show you all the plans, show you how to compare the plans, and then you as an individual would be responsible for enrolling in that plan and setting up payment for the plan and all of your responsibilities once you have selected a plan.
Great, thank you. There are lots of decisions that IBD patients need to make when electing health insurance. And as you mentioned, are there specific tools available to help them compare plans? Yes.
Once you log on to the health insurance marketplace, once you go into healthcare.gov, one of the steps that I shared with you, you create the account and then you apply, and right there, once you're on, that's where you're going to see all the plans and programs that you're eligible for, and you can compare them. What you want to do is you want to find the plans that look like they're the best fit for you, narrow it down to a smaller number that you're comfortable with, and then once you have 3 or 4, whatever you feel like is a good selection, the next step is you want to then go to that plan's website, look through the benefits. If you think that you have an upcoming surgery, you want to find out if the hospital you want to go to in their network, is your current physician, is he or she inside of their provider network? Are the drugs you use covered? So all the things that you are planning for and all the things that you think you may use your health coverage for, you want to actually go to the plan website, get all of the details and that information, including the cost, because I did share, again, how you can't base this just on monthly premiums, because although the monthly premium may be lower, if you are someone who uses health insurance or access healthcare providers more frequently, you may actually end up paying more by selecting a lower premium plan. So you want to keep all that in mind. Premium cost, the out-of-pocket cost, if your providers are in the network, and convenience, all those things you want to keep in mind when you're making a selection.
Great, thank you. Next question. Can you switch from one plan to the other when circumstances change, or do you have to wait until open enrollment?
Now, if you qualify for a special enrollment period, you're going to be able to switch. But generally, the only times that you can make a switch is during the open enrollment period. But there are going to be situations, things happen, things change, and you may be eligible for a special enrollment period, but it's going to be based on an individual situation, and you'll have to work with the Marketplace to make them aware of your particular situation, and then they will let you know if you're eligible for a special enrollment period.
Great, thanks. We have time for one more question. Do the standard health plans cost more if you have a pre-existing condition?
Well, that's what the healthcare law changed. Individuals who have pre-existing conditions are cannot be discriminated against because they have a pre-existing condition. So, no, you will not be charged more based on the fact that you have a pre-existing health condition.
Great, thank you. Well, we are quickly running out of time, so I just wanted to wrap up the webcast. So at this time, I would like to say thank you to Tarnisha for your presentation and for answering our questions. And of course, if your questions were not answered, please feel free to contact CCFA's IBD Help Center. Once again, we are open Monday through Friday, 9 a.m. to 5 p.m. Eastern Standard Time via telephone by calling 888-694-8872 or by emailing us at info@ccfa.org. And an archive of today's program will be posted on CCFA's website within a week, and slides will be available at our website, www.ccfa.org/resources/webcasts. Again, I would like to encourage you to complete the post-program evaluation. Your feedback is very important because it helps us shape future programs, and the evaluation can be found on the slide. And on behalf of the Crohn's and Colitis Foundation of America and the Centers for Medicare and Medicaid Services, thank you for joining us. And this concludes our program.